As a high-achieving woman, I have dismissed my physical symptoms. I dismissed them for over a decade, I would say at least. There was 10 years. When I realized that I'm a human, I need to put myself on my list. I make my decisions for my body. If something hurts, that means I need to go. It's not just about your healthcare team not believing you. Many times you don't believe yourself, so believe yourself.
Welcome to Wired and Worthy, the podcast for people who feel everything deeply, think about everything constantly, and have spent way too long believing that they were too much. I'm Dr. Amelia Kelley, your host, someone who believes the way you're wired was never the problem. You belong here exactly as you are. Because remember, you may be wired differently, but you are worthy always. Let's get into it. All right, welcome everyone back to Wired and Worthy. And today we are exploring something that honestly felt so near to my life experience that I had to reach out to my very dear friend, Dr. Amna Shabir, who is not only a doctor, but just really, I love how you bolster and encourage people. You're very empowering. I love, you explore perfectionism and all of this in your work. But amidst all of these layers, you are a highly trained doctor. And so I wanted to pick your ear about something that worries me about my clients, honestly, about some of my family, and even things I've experienced. And that is this intense physical fear that can happen sometimes, especially in neurodiverse folks, especially after trauma, where the thought of walking through the doctor's office door can feel crippling. So welcome. I cannot wait to dig into this with you because I really, truly believe we might actually save someone's life. I know that might sound dramatic, but by them listening to this episode.
Thank you so much for having me on, Dr. Amelia. And I completely agree with you. I don't think we're being dramatic when we say this is going to be a life-saving conversation because it's been about over a decade of practicing medicine in a variety of clinical settings, from the hospital settings, clinic settings, nursing homes, rehab facilities, across the board, adding layers of medical training in there. And I have seen the impact that the fear of going to the doctor can very much have on you. And I am a physician. I was raised in a dual physician household, so I've been surrounded by physicians all my life, and yet I have been on the other side of the exam table as a patient. And I've had some of those experiences happen to myself where I was left wondering, while I don't have what we would say intense iatrophobia or fear of going to the doctor, like worry or anxiety, I felt very confused. And things that would make sense to me did not make sense to me. And so when you are confused at a moment where it is so scary, like I'm going to potentially get some news that can change my family's life forever, my life forever, and now I don't understand it, the confusion can lead to a lot of the anxiety and the worry. So I am very excited to dig into today's conversation.
Mm-hmm. Yes, and to share a little bit of the personal connection to this, I don't know if I had told you about the first time, but anyone here who has gone and gotten a mammogram is probably aware of the fact that the first time you go, I don't even know, do you know the statistic? I'm not trying to call you out to know this, but do you know the statistic on how often the first mammogram is seen as suspicious? Because I feel like it's more common.
It is more common. I don't know the number right off the top of my head, but yes, it is more common than we would anticipate.
Right. Yeah. And then you add to this, if you are a woman who has dense breast tissue as well, it amplifies that. And so I went to my first screening, I was probably 2 years ago or something. And I got the news that something was off. And mind you, to add a layer to this was the same doctor's office where I had experienced my entire fertility journey. So all of those times of walking through the doors and my heart pounding in my chest, waiting to see if the baby's heartbeat was still going to be there, even as I'm feeling her moving. And I'm saying her because I felt the fear more intensely with my first pregnancy after that first miscarriage was really shocking. And so now I have this place where I already am carrying trauma inside me, although I still love my doctor. That's why I keep going there. And then now I got this news. Now I will tell you, I remember I had gone home that summer because I couldn't like fit the follow-up mammogram in before I went home. I spent the entire time I was home with my family sick, like mentally sick. And I say mentally sick, like I felt that nausea in my stomach anytime I would think about it, like a flip of my heart every time I would think about this appointment coming up. I remember when I went and got it, like they do like a more advanced screening for the follow up. I was doing all the things you were just saying about thinking about your future, thinking about your children. I mean, just quick, all down the line of all the worst case scenarios. And then it ended up being fine. And so fast forward to the next year, I kept putting off when I was going to go because I was thinking, well, I don't want to go now because if I get bad news, it's going to ruin this birthday. Or if I get bad news, it's going to ruin this event. It's like I was pre-preparing for something to be wrong again. And it got me thinking about, like, I know when anxiety comes up in my body, how to talk to myself. However, I can't stop the anxiety in my body from coming, just having a sensitive nervous system and the trauma that I had endured. So it got me thinking, and that's why I reached out to you, about all the people who never go to the screening, first off, because of the fear of something like that happening. And it really does play a factor in I believe, the mortality rate of, they were saying ADHD, for example, just as one example. Have you read those like really shocking studies about the mortality rates in ADHD?
First of all, I want to hold space and thank you for sharing this and making, creating this space worth
Yes.
sharing.
Oh, and I love you for bringing me back to the story and not going straight to the research. You're like, hold on, hold your horses. Let's not get right to that. Let's get to this. Thank you.
Because that might be the exact problem, right? We over medicalize everything and we
Yeah.
throw stats and numbers and I've printed an entire book to share with everyone today. So I will definitely be sharing some numbers. But that's exactly what happens. We get lost in the numbers and the
Yeah.
scary statistics, which are there to scare us. But at the end of the day, this is a very real human experience. What you described so elegantly right now and so courageously, I have seen that in myself as well. Although your doctor, you've had a great and wonderful relationship with them, that is the place where you got both joyful news and awful news. And you
Yeah.
don't know. You don't know if it's going to be fine. I mean, the probability is there, right? Things can be okay, but things can also not be okay. And
Right.
so holding space and grace for ourselves and our experiences in that moment is so important. And any good healthcare provider, any good physician, clinician, APP will always hold space for you in that tough time as well. What a privilege as a physician I have had, to be on the front seat to witness and support my patients' journeys through those experiences, even though I have shifted my professional trajectory in a different direction right now. My patients will still find me on social media and send me wonderful messages on how I validated and I saw and I supported their journey. So it's okay that you have that experience because a lot of times what happens is we end up gaslighting ourselves in the moment. Like, why are you feeling this way? Come on, let's go, let's go. And then I also
Yeah.
wanted to take a pause and highlight the calendar that women carry, high achieving women carry, and you carry, and all of us. Like, I don't want to go to the doctor because what if it's going to ruin that birthday that's coming up? Like,
Yes.
that is mental jujitsu that nobody else is doing and you're doing.
Yeah. No, that's a good point. I mean, and it's interesting because I think about how many people, how many women, a lot of times, who don't put themselves higher on the list. I think when I think about the statistics about how men's life expectancy increases with marriage, whereas women's decreases with marriage, and how is that about like where we're putting our focus of, okay, you gone to the doctor? Have you gotten yourself taken care of? You're saying this to someone else, but what about looking at yourself as far as have I gone? Now, this doesn't even take into account when I think about the countless individuals I work with, mainly women, who won't go to these very vital appointments because of sexual trauma. So then, I'm not even just talking about the OB. I think a lot of people don't think about the dentist, where you are completely exposed and vulnerable while someone is attending to you. So I feel like a lot of people who experience that have their own reason why they're terrified.
Absolutely. You have to. I have finally found the dentist that I can trust. I have had that personal history very long,
Yeah.
and I've been like on the run from dentists for such a long time. And finally, I found a compassionate dentist in
Like a good
2024.
visual.
That's right. So let me share some numbers, as we think about
Yeah.
worrying statistics and what is this worry? Is this worry? Is this anxiety? And when we think about what's happening, like you gave your example with the mammogram, there are two ways I would divide this. One is anxiety and worry that's linked with um, preventive care. And then one is illness related, like you are actually having symptoms and you are ignoring those symptoms. So
Yes,
let's
please.
yeah, was breaking this
Mhm.
down into two parts. So I'm going to be looking at some stats that I had printed and being specific and sharing this.
You mean you
So
didn't remember 10,000 things today?
no, I didn't. And I'm not going to
Good.
pretend to,
Good.
because that's what some people do, right? Online. I'm
Yeah.
trying to show up as real as I can.
Good.
So in the Prevent Cancer Foundation's like the 2025 survey, what they found was that 73% of US adults said they worry when thinking about routine cancer screening. So this is, we're talking about
Mm.
preventive care. 73% of
That's
us
a
are
lot.
carrying that worry. Yeah,
Yeah. I
that's a
mean, I can
lot.
relate. I think I'm in that status or
Yeah.
statistic. Hmm.
So and then it was interesting that the people who worried about, when you piece down and I look at multiple other studies, when you're really worried about getting cancer, you actually feel more inclined to go and get the screening done. Versus if you're actually really scared about the procedure. So let's talk about getting the mammogram. It is
No.
uncomfortable. It is painful. Actually getting the colonoscopy done, it's an invasive procedure. It feels
Yeah.
like, okay, wow, like, are they going to sedate me? What's going to happen to me? All
Right.
of those things where the entrance and of trauma and past traumatic events can become visible. Like if you're scared of the procedure, the chances
Yeah.
that you're actually going to go forward for that screening are start to like decline. So if you're worried about getting
Wow.
cancer,
Yeah.
more likely that you will want to go get screened. But
Right.
if you're
You'll go
worried about
despite
procedure,
feeling terrified. Yeah.
but if you're worried about procedures, and that can include, procedures that fall in that category of preventive screening, then your rates will kind of start to go down. You
That's
talked
really
about,
interesting.
yeah, yeah,
Well, I mean, I guess I'm saying from a therapist perspective, it helps me understand, and even just from like a friend and family perspective, like if you're sitting and talking with someone who is afraid to go, if you can find out if it's centered more around like the procedure, would things like learning the step by step of what it might be like help? Would it help to do kind of like very gentle exposure therapy type things like around the procedure and make it less about motivating them to have the proper fear of the illness? That's interesting.
you're absolutely hitting on the number one thing that can actually help in that context, which is, explaining the procedure in detail. And there's like, and explaining the overwhelm that we experience when accessing our healthcare system, patient navigation. I think I'm going to pause right here and also insert
Yeah,
this point.
please.
How hard it is to
Hmm.
actually get medical care in our healthcare system.
Yeah.
And so
Alone. Hmm.
alone, right? So I
Right.
am, in full disclosure, right before getting on the recording, I messaged my own doctor. I'm trying to schedule a procedure. I want to get the procedure. I am the perfect person for that procedure. And it just keeps getting bumped because the things are not aligning. And trust me, it's not me. And I feel so disempowered. I'm worried about the procedure,
Sorry.
but I actively am feeling that. Thank you. I appreciate you saying that. But I'm saying it out loud. And I know that it's not my doctor. They're doing everything that they can. There's like a host of insurance companies. Then there's all this paperwork, and there's all the stuff that is just, red tape that has to be crossed. And I have
Right.
a pretty high health literacy. So having low healthcare literacy just adds more to the worry, the fear, what you saw modeled to you, all of those things. And so when we talk about anxiety and worry about going to the doctor, it is nuanced. The best thing that we can
Yeah.
do is like validate our experience.
Hmm. That's a really good point. And I mean, I think in a way that would be a good reframe for me. Like I might be feeling incredibly anxious about going or my results right now, but I can practice gratitude, which helps with fear, practice gratitude that I have insurance, or practice gratitude that I have a practice near me. I mean, we live in a like a medical hub of the nation that we actually know each other in person, everyone. Like hang out at Taekwondo every week. But but that's such an interesting, like a really important point, not to devalue the real fears and anxieties, but if we practice gratitude about what we are able to do, that's a good point. I'm sorry that's happening to you. I have a vague idea of what you're talking about, and that's really disappointing.
It really is. And I love that you mentioned gratitude because that is truly what I am finding solace in as well. Because I wake up and I realize that there are so many parts of the world there is no access to care. There are so many women that
Yeah.
will not have access to this procedure that I have access to. I'm jumping all these hoops. And then I feel it's really important to also recognize the reframe that we might be having in our
Yeah.
mind. And I don't think that it devalues anxiety or worry. Like I don't think that there's the way I have started to look at healing journeys is it's all complex and intertwined. We can have all those moments and we can have the moments of gratitude, right? So I have access to medical care. Like you mentioned, we're in an amazing area where there's so many clinicians out there. If my life is in imminent danger, I can always seek help. I think that a lot of what's happening also is being fueled by social media culture, this so-called wellness influencer culture. As a physician, I want to show up a little bit as an advocate for all the amazing doctors and advanced practice providers, nurses, PAs, therapists that are out there that are actually doing the real work on the front
Yeah.
lines within the
Mhm.
system, fighting insurance companies, fighting red tape, fighting their own mental health, their own burnout, while they're
Mhm.
running on zero. And what the patient is seeing on the other side, they're not having a good experience either. And that leads to this anxiety and worry. As
Yeah.
far as medical training goes, people keep saying, well, doctors don't know how to talk, blah, blah, blah. I hear this all the time. Sometimes I even hear physicians say, yes, of course, like where the school that you attended does, there are fine prints. But across the board, all physicians do get training surrounding empathy and surrounding breaking bad news, how to hold a patient's hand. And I don't think people talk about it. Well, you have like
I
billions.
didn't know that.
Yeah, you've all these influencers. It gets me every time. Because of
Yeah.
course they're trying to sell you something, right? They start the conversation by, here are three things your doctor is trying to hide from you. Here are three things your doctor didn't talk to you about menopause. Like monetizing everything and anything. And what is that doing actually? And how does that tie into the anxiety and worry? It's because they're fracturing relationships that physician and patient has. They're fracturing the relationships that psychiatrists, therapists, PAs, NPs have. Like the people that are certified, the people that went to decades of schooling, that
Yeah.
the journey to get to that line. And today I printed all this paperwork and I have this here. Why, Dr. Amelia? Because as a physician, whatever comes out of my mouth holds weight. It holds
Yeah.
credibility. I can't just turn on the camera and start making up numbers. My words have integrity attached with it. And so what this influencer culture is doing is it's fracturing that relationship. So when you have that anxiety, you get the news, you're worried about cancer, you're worried about illness, you're worried about your procedure, you might not feel that you can trust your clinicians because of the feed that you're consuming. You know,
Yeah.
while I'm all for holistic well-being, clean eating, nutritional, amplification supplements,
Right, why
you go
wouldn't you
do the
be?
thing.
Yeah.
Yeah, I mean,
Mhm.
but you cannot dumb down healing and medicine into all like here are three things they're hiding. Like, yeah, as if your doctor went to school so that they could, when they're practicing, hide stuff from you. So
Right.
and this
Mhm.
feeds into distrust.
I appreciate you bringing that up just because I've explored the other end of that too, where, I've had guests on where we've talked about medical gaslighting and like the power dynamics and all of this, but I think it's also really crucial and important to understand that any profession can have bad players, right? Any profession can have people who are not necessarily good listeners. But here's the other thing. I don't know if it's always that they're vindictively trying to be a bad listener. It might just be style. It might just be personality. For example, not one therapist is going to be everyone's cup of tea. Not one doctor is going to be everyone's cup of tea. So if you're with a doctor, like I said, I'm still going to the practice I go to despite the traumas I endured there because I love Dr. Shashadri. Shout out to you. Um, I still find it funny that he plays like club music in his office. I don't get it. Like I remember when I was hearing about the news of one of my miscarriages, we're talking about the pathology report and like Lady Gaga's singing in the background. Like at the time I'm like, what in the world? But now I can look back on it. I've done EMDR on the whole thing, so I can look back with kind of a humor about that moment. But um I think I, first of all, am all for your passion. Like, this is a place to express that. And I think it's great to see someone that I trust, saying what you believe to be true about the people out there who want to help and heal. So, yeah, I'm here for it. But you also, I will say, when we were kind of having our little chat, you had brought up some interesting things about how all of this might impact individuals. I had like briefly mentioned the mortality rate with ADHD, but I'm very intrigued by like how this can impact people with hypersensitive nervous systems, ADHD, maybe autism. When I think of autism and ADHD, I think of maybe a little bit more around the procedure fears, like you were saying. I could be wrong. And when I think more about ADHD, I actually think the fear of the outcome, because ADHD brains have this really creative, non tangential way of, we are really good catastrophizers. Like we can think about every possible potential negative outcome that can happen and create full worlds around it. And so sometimes the overwhelm can keep people from with ADHD, I think, from getting there. And then, let alone, we talk about the executive functions of making the appointment. So I wonder if you could speak it about a bit about our listeners who are wired differently.
I love that question. And I also want to acknowledge the earlier comment that you made. And I just want to say this, that I think that approaching things with good intentions and giving people benefit of the doubt always helps. And recognizing that when you are feeling anxiety and worry, taking a beat and asking yourself, well, are there things in my environment that are amplifying this, such as my social media feed or people that are saying things to me, is important. But always be your own advocate. And there's nothing wrong with it. If you are advocating for your own health, I always empower and I tell my patients to do that. As a caregiver, I will always do that. I will do that for myself. And any good clinician and doctor would appreciate you for doing that. Now, in specific to the amazing humans out there that are neurodivergent, well, the first thing is there's not a lot of specific data. I was pulling through things, trying to find out, and we need to do more studies on this neurodivergent experience through healthcare.
Yeah.
Very less data when we talk about HSPs.
Hmm.
I found one, which I think is somewhat of a credible study in Scotland in 2024. They did a general practice study in patients with ADHD where they missed 60 to 90%. They were more likely, 60 to 90%,
Wow, that's a lot.
to miss your GP appointments after they adjusted
That's a
for
wide
total
range too.
appointments.
I'm always curious about, is it 60? Is it 90?
I know that's such a big range, and I was
Yeah,
trying to come up with a better study that I could share. Audience members, if there's anybody who's an expert out there who wants to share
please, yes.
another study, please
Drop
drop
it
it
to
in the
us.
chat.
Yeah.
Yeah, where you're listening to this, engage with us.
Mhm.
But the point that I was trying to make, first of all, is like we need more data, and
Absolutely.
the second thing is that that is a large number, and we're talking about general practice. That means these are the humans that where you go to the primary care doctor, you go to your GP. That's where you're getting funneled into going and getting your preventive care for colon cancer screening, for breast cancer screening. And if that's not happening, that's number one. And
Yeah.
that's also the first place that you go where you're actually getting the detection for serious illnesses, right? Like we're talking about, I know we've mentioned cancer quite a bit, but what about all the chronic complex diseases that are also prevalent, such as hypertension, diabetes, obesity? I know that I use that word with a grain of salt because there's so much tied with the word, but it still continues to be a medical diagnosis, so using it in that sense. But what about osteoporosis? What about all these other things, right? We don't talk about fall prevention. What about
Yeah.
healthy aging? What about advanced care planning? End of life planning. That advanced care planning does not happen in nursing homes, needs to happen years before, letting your doctor know what your wishes are. So there's so many important, impactful, and what I would say high yield, beautiful things that need to be addressed in general practice office that are missed opportunities. For me,
Yeah.
my heart breaks for all the missed opportunities. And so we, I think as a system, as a healthcare system, need to do a better job with it. I'm also going to add a specific touch point because the other day we were talking about what it is with another colleague of mine who identifies as an HSP, being a clinician and being a proceduralist in the hospital when you have HSP, we're all like the lights, the bright lights, the color, the
Yes.
smells, the sounds, they're so like, and you're providing care.
Do you know what you just said, like completely struck my very first experience as no, it was my second internship. My first internship was I loved, but in grad school, I was not my like 3 month internship my first year, but the second one that was like a 9 month commitment. I got put in a persistently mentally ill ward at Rochester Psychiatric Hospital with geriatric patients. And we know in psychiatry, geriatric is a wide range because after you've been medicated for a long enough period of time, you tend to age more quickly. So I had people who ranged from 50 to 80, but I became depressed. Like I became so depressed during that year. I went to my supervisor, my not the one at the hospital, but the one that was my kind of collegiate one, and I begged her to move me out of that. And it was because there were no windows. It was an intense smell. The patients were there was like very little order to this. I'm an art therapist trying to go into these rooms, and I remember being pulled into I remember I was running tai chi. I don't know. I was doing all these crazy things and I started to feel depression symptoms. I have mixed emotions about being made to stay in it. I am grateful for the sense that there's nothing I can't do now. I feel like I genuinely can I felt like that carried into my profession. But on the other hand, I hear you. Is what I'm saying. Like as an HSP, I didn't know that's what I was at the time.
Yeah.
I started to feel like I was taking in the depressed state and the kind of I wasn't psychotic, but I was like taking in that instability that psychosis can feel like. It was a lot.
I want to hold space for your experience and also share that my second board certification is in geriatrics. And as somebody who worked in nursing homes and rehab facilities, we would say almost 4 years adding my fellowship, like it's a whole different experience. And I
It is.
worked, you're absolutely right with oh my gosh, if I could basically demolish all these buildings and create what I would love are
Like,
greenhouse models, right?
right.
There's
Like,
so much
why
better.
not have? I felt trapped. Like, it was in the deepest, deepest part of this big old hospital. I don't know how any of them could have felt good there.
Absolutely. And that's so true, right? Those are and now we know better, so we should start doing
Right.
better. Maybe at
Yeah.
that time we didn't, even if we have compassion. Now reversing that experience from being an actual clinician to being on the other side, and now you're the patient who's going
Yeah.
through all these procedures. And I think this is where you use the term medical gaslighting earlier. This is where understanding and recognizing your neurodiversity and leading with that, sharing, partnering with your clinician on that. And I will tell you this, most people that go up and scream online have had bad experiences and have been in bad positions, and they can use the platform to advocate. But how many of us go to a doctor's office and have the most lovely experience and then go and write it? Very few of us will actually
That's
do that.
true. Yeah.
Mostly when we're angry, when we're frustrated, we reach out. And so I think that this little bit of this mentality as a community, we need to start reframing. But more and more clinicians, more and more doctors are making space for this. I especially want to give a shout out to all the clinicians that are trying to escape the insurance
Yeah.
model and offer more unique ways of practicing direct
Hmm.
care where you're outside the red tape. And they
Right.
say, like, for patients with neurodiversity, like, our office accommodates for that. So now, you walk into the office, one of my colleagues does it. She'll ask the patient, she'll turn off the lights and she'll just like, close the door, open the door, and, let's bring it down a couple of notches
Yeah.
so you and I can actually have a conversation in which you're comfortable.
You said dentist earlier. I accidentally found my dentist when I did the Invisalign. Like I had been working with someone else at a very clinical feeling space, but then when I found where I go now, they have a self care menu. So the menu is literally sitting on your chair when you get in there and you pick it up and you get to pick what, and this is not extra. It doesn't cost extra. This is all part of it. You get to choose like if you want an eye mask, if you want like a scented pillow. It's just, it's almost, sometimes I laugh at it. Sometimes I'm like, no, I'm good. And sometimes I'm not. Sometimes I'm like, yeah, I'll take the scented, weighted, bougie blanket. But those little things make such a difference. So I wonder if, is there a website? If there's not, I feel like there should be. Not like Yelp, because we don't want to, kind of inspire more complaints, but almost like where a doctor's office could get like a neurodiversity-friendly stamp of approval. That would be
That's
really
great.
cool.
It really would be
Project.
cool.
I'm just kidding.
Project that, yeah. And
That,
again,
and
if
we're
any
going to
of the
study it too.
exactly, and again, if there's anybody who's out there in the audience, inviting physicians and clinicians, share like if you are doing this, and is there somebody regulating this centrally? I want to just add one comment. You and I are having this conversation. I love that self-care menu, but I've also practiced medicine in extremely resource deplete areas and cared
Yes.
for patients,
Yeah.
such phenomenal human beings. And so it is with tremendous privilege that we can have this conversation, including it
Right.
is with tremendous privilege that people can afford, direct care.
Right.
And that is where, and this is a whole different conversation, the sadness and the complexity of our healthcare system and the disparities that are so real. And so I just wanted to take a moment and acknowledge the privilege in which some of these conversations are happening.
Oh, I mean, I fully understand that not all people get to choose between 70 dentists. I don't even know how many we have in our area, but you're right, it is. And I mean, for anyone who can take the time to choose, that can be part of a very empowering journey. I mean, a lot of the women that I work with were almost afraid to break up with doctors they were working with that they didn't feel comfortable with. And I think that's another end of this too.
I'm having a lot of thoughts.
Okay.
Yes. Yes, I when I started practicing after residency, and my first practice was primary care. I did that for about 4 years. Inherited a panel in which humans had been in contact. The patients had been with the physician for a very long period of time, and it was interesting to see the bond. And sometimes, of course, the physician had done a wonderful job, and that was a testament to that. But some of the relationships, which I would perceive as dysfunctional, but they just continued, and it happened with me as well. Some patients, like, would not listen to anything that I would say. I would share decision making. One of the physicians who had, I had a quarter in which I had 100% patient satisfaction score, which is unheard of almost. And I would ask my patients, like, when I was leaving the practice, why did you keep coming back? I'm just curious to know. And they would say, at the end of the day, I felt like I might not agree with you, but you were the most educated. And I would go back and actually cross check what you were saying, and it all made sense. And, I felt like you really cared. So, but it is very interesting. You mentioned about women in there in the conversation, and I wanted to highlight a little bit of a difference that we see when it comes to men and women seeking care in the
Yeah.
clinical settings. So,
Mhm.
again, I'm just pulling up some of the helpful work that I had printed out. So, women actually utilize more preventive care visits than men,
Okay.
and they'll go more to ambulatory care, whereas men will delay care as much as possible because they feel they're too busy, or they're waiting for their symptoms to pass. These were comments. And some men report feeling judged in medical settings more. I guess that was interesting. That can reinforce avoidance. Maybe they're supposed to project the strength or toughness. But in this, there was also something very interesting, which was that many employed women report delaying their own care until symptoms worsen or they begin affecting their daily life, or women in caregiving roles where they're going to basically cancel their own appointments but make sure they get their kids, their parents,
Right.
other
I see
humans
that a
that they're
lot.
caring for, yeah, to their appointments. So that was
Mhm.
interesting. But men definitely underutilize preventive care. That was a common theme that appeared among multiple studies.
I'd be so curious to see if they separated these men into attached or single as well,
Mhm.
right? To kind of like go back to that comment
Yeah.
about, because I'm trying to think about how my own ADHD husband does with making appointments. I will say I think it usually does come down to me saying, "Did you make your next one?" And I'm actually curious your thoughts on that. I feel like for people with ADHD, especially, or people who are like, for your point, really busy, or even if you have a fear and you avoid making the appointment because of a fear, I find if you're able to make an appointment before you leave, like if you're able to have something set up where you don't have to executive function to make it happen down the road, I feel like the statistics would be so much higher for actually getting to these appointments.
You point out a very important thing, which we're all experiencing in this day and age, which is cognitive overload and cognitive overstimulation. And so, what's happening potentially is that we have this background music playing, right? Okay, I need to go. And I guess it's that birthday where I need to get all the screenings done, but I'm just, it's happening. But then I have all these projects. There's all this stuff happening. Now I'm trying to get, like myself, I'm trying to get in to see the doctor. Doctor is not available. Insurance causing a problem. Even so, I'm talking about somebody who has resources in the best case scenario. Like I consider
Yeah.
myself a best case scenario, and yet you
Hmm.
don't have all that. But if all these touch points, all these barriers, if they were easier, if I could just schedule online, if I put it on my calendar, I do it a couple of months in advance, I block half the day. And you know how we talk about self-care? We love talking about self-care. As a physician, I my plea to anybody listening, your preventive healthcare is part of your self-care. And that doctor's visit
Yes,
is part of self-care. Mammograms
100%.
are self-care. Colonoscopies are self-care. Oh my gosh, probably get people are not gonna like me saying colonoscopies are self-care, but it's true. So once that is on your calendar, it takes off a lot of fatigue. And I looked at what the evidence shows as the three most helpful things when we talk about actual worry and anxiety in taking them away. So the first thing is actually patient navigation. Helping patients schedule, prepare for, attend, and follow up on care
Yes,
improves screening uptake.
I can
There's a
see that.
study that absolutely, supports that. And because it turns a confusing experience, like we were mentioning, and all these barriers, even if it doesn't seem apparently confusing.
And you're not adding stress unrelated to the actual stress. Like you've got this anticipatory anxiety, and then you have the load. But if you can at least remove the load, to your point. Yeah.
Yes.
Hmm.
And this might be a little bit of a tangent. I'll go back to that afterwards. But the second thing that's really helpful for worry and anxiety when it comes to medical appointments, and this includes people who have that iotrophobia, that's very severe manifestation of this, where you have like white coat hypertension, merging in it, and all this, all the terms that we can label really is
Yeah.
CBT. That has the
Mm.
strongest evidence for
Hmm.
treatment for health-related anxiety. It shows sustained symptom reduction in various trials. It is highly treatable, and it has the strongest evidence base that we can find when we're talking about CBT, cognitive behavior therapy.
Okay.
And then lastly is acknowledging and offering trauma-informed care, because it's about the body at the end of the day, right? We're talking about
Yeah.
dentists. We didn't even go to the OB's office yet. So emphasizing trust, emphasizing choice, collaboration, autonomy, it improves patient experience and engagement. And again, to my prior experience, I think that anytime I've had the privilege of caring for somebody, I try to make sure that they know that they can trust me and that whatever we're going to do, like every step, every touch, every process, it is communicated. I might sound like when I would have medical students or medical trainees, they would just think like, oh, what is, Dr. Shabir is going on forever. But I would send handouts before, videos before, during, explain, talk, talk, talk. I've been on the other side. It's not pleasant. Sometimes all you need to do is you have to be a patient to be a better clinician.
Yeah. How do you be a good patient? Just curious. Like what have you had to do, because you, to me, are wired very uniquely at a breakneck speed, and you do load yourself up a lot. So how do you make sure to like get through? Is it, I don't know if you've ever experienced medical anxiety, or if it's the overload of making it happen for you. Like what have you taken from what you've said today that has helped you?
That's a great question. And I will say that I have experienced medical anxiety. I have severe claustrophobia, and I've had to do multiple MRIs in the past, and that has been challenging. I've also experienced medical gaslighting and actually do not go to that primary care office anymore. So if anybody's listening, I'm
Good
not
for
saying
you.
I'm not
Mhm.
saying that this is some like idyllic state, but I've also equally found many healthcare workers that are out there, nurses, doctors, PAs, NPs that truly want to help me succeed. And what
Yeah,
I have taken away from all of this is that if I don't want myself to succeed, I can have the best medical team, but if I cannot trust them and I'm not ready to receive what they're offering me,
yeah,
then nothing will ever happen. I have to remind myself at the end of the day, this is my body. As a high achieving woman, I have dismissed my physical symptoms. I dismissed them for over a decade, I would say at least. There was 10 years, and then there have been more times. But when I realize that I'm a human, I need to put myself on my list. I make my decisions for my body. If something hurts, that means I need to go. I will forget. I'll do
yeah. No one
everything for
else
my
knows
kids,
it
for my
hurts.
family.
Yeah,
And
good
I
point.
will go and I will find the best clinician that I can find, and then I'm going to trust them because I'm not going to go back and forth. I will do my homework. I will sit with you, and I'm going from very personal experience. Doesn't mean it has to be for everyone. And then I'm going to release control to my medical team. Do what you need to do to make me feel better. I've done that when I have had surgeries, when I've had procedures, and when I have had my kids have had procedures.
Wow, that's powerful and hard. And I could see where that's the CBT piece, like because the cognitive restructuring around I need to know every single thing happening, which is valid. We talked about the usefulness of that, but that kind of radical acceptance piece of okay, I've done my homework, I've chosen the team, I'm going to choose to entrust them to care for me. I could see for people who have endured trauma, that would be incredibly difficult. But I can also see, I've experienced that. Like, I think about the trust that I had to have in my provider, which then led to my rainbow babies. Like, if it hadn't been for that, and if it hadn't been for finding extra support, I mean, I did find a holistic doctor to also support me. But what I loved is that I then went to my conventional doc, who I still go to, and I shared with him the things that my other doctor was sharing with me, and he was totally in support, of what I was exploring. So I think a nice balance. If I were to like think of all the things that you talked about today, and then if I missed anything, and if there's anything you wanted to make sure to give to people before we sign off, we could talk about this for probably another hour. But one is I that statistic you gave about the difference between fearing the procedure versus fearing the potential outcome of illness is very inspiring to me because what it shows me is if you're fearing the illness, it's scary, but we can't walk through something until we walk through something. And I have more faith that people will get themselves the help they need. If it's the fear of the procedure, that's inspiring to me because that feels very addressable with understanding the procedure. I don't know if you saw the Holderness. They had a joke about prepping for a colonoscopy and they made it like a keg party where she was like doing shots of the stuff and like, it was pretty hilarious, but it made light of the procedure and what you have to do for it. But that really, ooh, that's such a big takeaway. Talking about obviously the differences in how we see it in gender and just those very kind of terrifying statistics about ADHD and neurodiversity. So I would really speak to each and every one of you listening who feels wired differently. You matter, your health matters. And just like you just said, Dr. Shabir, no one else knows the pain that you feel. And the only way you can get it addressed is if you go do the thing. So I ask you, is there anything in your amazing encyclopedia of notes that you have acquired for this chat, which I really appreciate, that you did not get to bring up that you want to make sure you give to the listeners?
I want our listeners to have so much love for themselves and for the value and importance that they bring to this world. I think the one word that came to my mind, which was not in the statistics, but more so comes from my deep personal experience, is avoidance. And avoidance and and gaslighting, really, like, it's not just about your healthcare team not believing you. Many times you don't believe yourself. So believe yourself. Do not avoid. And this is self-care and self-love. Go see your doctor and ask them to explain things. I cannot highlight enough. I have had to explain so much. At any time my patients would ask things, I would explain. There's nothing wrong with
Mhm.
asking. I am a
Yeah.
doctor and things don't make sense to me many times. And I definitely shout out to the Holderness family for that reel that they made. I was watching it while I was actually getting a diagnostic colonoscopy. So it was
Oh my
very
gosh.
timely.
They made it for you.
Yeah, absolutely.
Obviously.
So really, like, lots and lots of love. And thank you, Dr. Amelia, for having this conversation. I think it's so
Mhm.
important and impactful.
Mhm. And I'm, again, so grateful not only for our connection, which we made through TED, but our friendship that has developed from there. And I don't take that lightly because I don't make like, I don't just like make, what did I say? Something like networking friends. I'm like, you've crossed over into the real realm. But so I get to have contact with you whenever I want. People listening might not know where to find you, where to get support. And you also have a fantastic podcast that has been, I think it's top 3% of the world in your category, correct?
Yes, we recently got into top 3% of global podcasts. I'm just so honored about that.
Amazing.
Thank you.
Amazing. So, where can they find you? What is the name of your podcast? We want to make sure that they don't leave empty handed and they can stay connected to you.
Thank you so much for the opportunity, Dr. Amelia. And I know I very much receive and reciprocate this amazing friendship that we have developed. For the amazing audience members, I invite you to actually check out this quiz that I've created. It's called
Oh, yeah.
what
Hmm.
type of perfectionism is sabotaging your success? Because a lot of the worry and anxiety also surrounds perfectionism. You can find all my links, including the podcast, which is Success Reimagined with Dr. Amna Shabir, MD. If you go to success-curated.com, it has
Hmm.
everything. And connect with me. Let me know your thoughts.
For sure. And I will say, I love that Dr. Shabir is so open to like people's perspectives because I remember you making that quiz and you took an idea I had and you ran with it, which was I felt very honored. And I love that you like really listen to people, which I think is such a thing to remember. This is a doctor right here. This is someone who can be on the receiving end of your fear and who will listen and support you. So for everyone listening, please go take care of yourself. Make the appointment, make the follow up appointment. And remember, you may be wired differently, but you are worthy always. Thanks for being with us, everyone.